Sleepless nights in hospital hallways, 18-hour workdays, macro-level tragedies since March. This is a glimpse into the life of psychiatrists in the age of coronavirus.
How are you?
How are you? Doing well?
I'm good to see you.
Likewise.
Emilio Montero, a 62-year-old psychiatrist practicing in South Florida, has witnessed the effects of the pandemic firsthand.
I do mostly inpatient psychiatry, so we have seen an increase of hospitalizations in the local psychiatric units.
Patients with worsening symptoms of depression have suffered a sense of isolation, powerlessness, and fear, leading many to fall into a trap of panic disorders and substance abuse.
We've seen a lot of patients with worsening severe symptoms of depression, all the way to increased suicidality, and they see life as a process in which this disease greatly affects the outcome, and they see at times no points of continue living in fear.
Procedures at hospitals have changed drastically. The most significant response to the pandemic involves a switch from outpatient to virtual care. Zoom, video conferences, and telephone meetings have served as Plan B, but most patients do not have the technical acuity or the resources to access virtual communication.
That telephone communication doesn't give me the same understanding of how somebody will feel. I don't see the corporal changes. I don't see how I can read between the lines. I don't see the sadness. I don't see the affect. I don't even see how they associate to each other and their own personalities.
The lack of physical touch, the barrier of the masks, and the cold and empty environment at hospitals has also distraught those in inpatient care.
Patients have complained that they feel that they are incarcerated. So I remember many of these instances in which grandparents have been looked through windows, doors, and will say that they rather die than die of isolation, of loneliness.
Headline after headline, this virus is becoming the seed of a major mental health crisis. Suicide and self-harm rates have skyrocketed since March. Psychiatrists like Montero feel hopeless.
As a healer, I like to consider myself as a helper, as a physician who takes care of other patients. I've seen a big boundary between the patient and myself. At times it makes me feel isolated, makes me feel that I'm not doing as much as I could.
For the rundown on WNYU 89.1 FM, I'm Maria Yoki.